Okay, so the Center for Children's Advocacy, we are New England's largest children's legal rights organization. We provide legal representation and advocacy for Connecticut's most vulnerable children and youth. My name is Kathryn Meyer. I'm an attorney at CCA, and I'm the director of our Medical Legal Partnership Project at the Yale Child Study Center. We have a unique perspective in our project of being the only MLP, medical legal partnership, at a children's behavioral health setting in the country. So we're very lucky to benefit from the expertise of the professionals at the Child Study Center, some of whom you will hear from today. And so in that way, this webinar kind of mirrors the partnership that we strive for at the MLP, which is the collaboration of lawyers and medical providers and professionals who are working together to improve outcomes for children and families. Next slide, please. So I mentioned the few logistical notes. And again, please do keep those questions coming. We are recording, as I mentioned, that will be available afterwards and will also be emailed out to those who have registered. So when we started thinking about the plan for today, we decided to really kind of hone in on a few notes to start the school year off, giving people the tools they needed to be up to date on legislation and policy, and then thinking about this kind of unique time of year and how we can best support our students and families during this time from a couple different perspectives. So the roadmap will be, as I mentioned, those legislative highlights. We'll then move on to Dr. Yann and Meyer Gonsalus, two of my colleagues at the Child Study Center, for their perspective on barriers to student success, and will help us start to kind of lay out those advocacy strategies. Then we'll move on to Christina Ghio, who is the Associate Child Advocate at the Connecticut Office of the Child Advocate. She is an attorney and expert on special education law, and she'll help us start to kind of map out some of those tools as well. And finally, we will finish with our newest colleague at CCA, Mallory Sanchez. Mallory has been working with us for 2 years in collaboration with the Yale Gender Program, and is now a Singer Fellow at CCA. And Mallory will offer us some legal tools for addressing bullying and harassment through state statute and Title IX. Next slide, please. Okay. So in looking at some of the highlights of this past legislative session and thinking more broadly about school climate, right? And how our students experience school, how our staff experiences school, and how they remain connected and engaged. First, the definition of bullying has kind of gone through a few different iterations throughout the years. And so as we further refine our understanding, the legislature has now changed the definition to, quote, unwanted and aggressive behavior that involves a real or perceived power imbalance. Now, this definition is important because it's triggering different legal responsibilities and different legal protections around how to, again, keep kids safe and make sure that the climate is supportive of them. So also in the context of school climate, the legislature has introduced a new term called challenging behavior. This is defined as behavior that negatively impacts school climate or interferes or is at risk of interfering with the learning or safety of a student or school employee. And so this term is a little more encompassing, and it's more descriptive to focus on the impact of the behavior versus some of kind of the older terms that might have used more judgmental or kind of punitive terms. And so it's going to come, this term is going to come throughout legislation, and it's going to be, again, further refining the roles of different people in schools, for example. So one such place that's going to come up is the role of the school climate coordinator, who is now responsible for developing strategies to prevent, intervene, and respond to this type of behavior. So what that means is that instead of kind of just looking at bullying in this more narrow sense, we're looking at this broader experience again of how children are going through their day and not getting too hung up on whether or not it's meeting this statutory criteria, but really focusing on how the child is experiencing the school day. Okay, next up, I want to touch upon the new responsibility of CABE, which is the Connecticut Association of Boards of Education, to create in partnership a school climate policy that will be adopted statewide by school districts. So this is an opportunity for a little bit of uniformity across districts and really implementing some of the practices and some of the evidence-based practices that we know will be useful in this in addressing school climate. Along these same lines of kind of uniformity, the collaborative on social and emotional learning is now also tasked with developing a uniform bullying forum. And we're part of that collaborative, and it's a really great opportunity. We bring the vantage point of our clients to these types of, forum. And so we're looking at it from how do we make sure that it's more accessible for parents to report behavior that they want to be investigated, that they want to be researched to make sure that their child is safe. And so this uniform bullying forum is giving us the opportunity to have a place that we can point parents to so that it is more accessible to them. We're also looking to more accurately capture the behavior that we're talking about so that we can better understand how to address it, and also to make sure that we really close that feedback loop so that parents are getting information as to how this situation was dealt with, and kind of, making sure parents get that response from the school so that they know what's going on and how things are being addressed in the school environment. One last thing in this area I wanted to mention is that the Commission on Women, Children, Seniors, Equity, and Opportunity is also tasked with putting together Title IX toolkits. And Mallory will touch more upon this topic later, but I think it's important that Title IX really seems like an area that needs to be explored further as a tool and as a resource. And we really hope that we continue to support the understanding of school districts and parents as to their rights under Title IX. Next slide, please. So just a few more provisions I wanted to point out before we go on to our speakers. In terms of discipline, and I guess kind of talking about that challenging behavior area that we touched upon earlier, there is each Board of Education has to implement a restorative practices response policy. And this is a policy that will be implemented by school employees for addressing these incidents of challenging behavior or student conflict that is nonviolent and does not constitute a crime. So between these first two bullet points here, you see that we're really trying to separate out what would be addressed by school administrators versus what would be addressed by school resource officers, police officers that are in schools. And so the next provision requires that the MOUs, the memorandums of understanding between school districts and police departments have to be further refined and really kind of really honing in on what kinds of actions that are under the purview of SROs versus what types of actions that should be under the purview of school administrators. And this is important because sometimes SROs are relied upon to do different functions that's really more within the area of a school administrator. And we just want to make sure those roles are more clearly defined. To that end, there also is a new requirement that SROs have to report upon some of the actions that they take to their own police department. I think, again, helping people better understand how to enumerate those roles differently. Now, moving on to a requirement for the School Discipline Collaborative, which is a group that is run by the State Department of Education and involves all different stakeholders, including CCA and other folks on the call. And one of the tasks for the School Discipline Collaborative is to develop guidance that will reduce exclusionary discipline for our youngest learners. And that'll include coming up with best strategies, best practices, interventions for preventing the use of exclusionary discipline and trying to figure out what is most impactful for keeping our youngest students in school while also making sure that their needs are addressed. And finally, I wanted to just mention that the State Department of Education has the responsibility to oversee the implementation of plans that will reduce suspension and expulsion in districts that have identified as high or disproportionate rates of these measures of discipline. So again, when we talk about exclusionary discipline, we're almost always talking about not just high rates, but high disproportionality, because unfortunately that is something that remains. Even as we reduce the overall numbers of the use of exclusionary discipline, we still continue to see disproportionality amongst, race, ethnicity, different disability categories, et cetera. And so I think it's really important that our State Department of Education still finds it really important to address that, particular piece of it, and not just kind of congratulating ourselves for reducing the use of this discipline, but really making sure that it's, that is being used fairly across all measures. Okay, next slide, please. So this just kind of lays out what we're talking about today and how we think about our students and their needs, and learning about some of these kind of legislative and policy updates and moving towards what we're seeing currently and how we're starting off the school year. We're going to talk about, Dr. Poncin and Mary are going to talk about kind of what they see from their lens and their vantage points. And then we'll use some of that information and expertise to move along and thinking about the legal tools and advocacy strategies. So we will start. Oh, next slide, please. Starting with Dr. Yann Poncin.
Hello, thank you, Kathryn. So I will share about clinical perspectives for mental health in schools, which is a very large, complex topic about which many of us are thinking and working with and dealing with. I think the first things first is to start where things are in terms of the degree of the mental health challenges in school. And this is truer the older grades you get, but the numbers have increased over time through national surveys about the number of kids who are having difficulty in school, behaviorally, socially, emotionally, ranging from suicidal thinking, which is perhaps 20% of high schoolers have had suicidal thinking in the last year or so. 3% have had suicidal attempts, so it's very common. But there's also drinking, there's getting in cars with friends while they've been drinking, there's sex, drugs, the usual thing, although those have somewhat declined as people are less engaged in the out world and more involved with their smartphones. So how do mental health issues manifest in school? Mental health in children, I think, can best be viewed, not exclusively, and also in adults, is your capacity to cope is overwhelmed by stress. So your own personal, individual capacity to cope in the world, within your family, life's expectations, and or within school has surpassed, the stress has surpassed your ability to cope and to function. I think that is a way to look at it. I think we rarely think in terms of pure biological terms that someone has anxiety or depression and it's a physiological medical event. It is medical. But I think in working with children, you certainly have to look at the larger matrix of their interpersonal social life, their family life, in order to see how they're doing and as a contributor to how they're feeling in school. The main things to be concerned about at the higher end of things, higher intensity, and there I'm talking about, usually we're talking about something chronic here. Many times a child might miss a day of school here or there. A child might get suspended for misbehavior here or there. So I'm going to talk more about the kids who are starting to have more manifest problems. Their grades are going down. They're having difficulty more pervasively. In terms of school avoidance, there's 4 ways to look at school avoidance. There's the dinosaur version of school avoidance. That's just an analogy to say that if I go to school, I'm going to be eaten by a dinosaur. I'm going to be I'm going to be hit by a bully. I'm going to be bothered by a bully. Something bad is going to happen. Something bad has happened. So I don't want to go to school. Then there's the not my concert version of school avoidance. I like certain music. I don't like other music. And this music really grates on my nerves. It makes me feel uncomfortable. I don't like it. So it's the non-specific feeling of being in school that just feels a bit too much, whatever that non-specific feeling is. Kids might not be able to put it in words if you ask, but it might be a child with social anxiety where you worry about social evaluation. So getting in front of the class, speaking, or the challenge of interacting in the cafeteria. And these can be kids with very good social skills, but their perception is one of being evaluated as an example of just, it's not my comfortable scene. And then so those are the two versions that will push the kid out of school. Then you have the other two versions that are pulling a kid home. And that is where it's more fun to be at home or in the community. So sometimes those can be the kids who are truant. Not that they can't have a combination of things, but with going home, it's just more fun to run with my friends at 12, 14, 15, 16 and leave school and not be in school, a more quote truant category where it's more about, I prefer this to that. Things are rarely black and white. And then the other pull to home category is kids that worry about their families. They've had trauma, they've had interpersonal violence, they've had a death in the family, they have factors that have them worry about what goes on at home, and so they want to be at home. Or their parent reinforces that because their parent also gains comfort from the child being at home. It's another example. These, of course, all interact with the world is much more comfortable at home than it used to be. You can have an iPad, you can have your screens. It's not boring. Boring is a very powerful motivator to want to get to school. Missing out on social life is a very powerful motivator, and you don't miss out on social life as much nowadays. So those are the things that are keeping the kids out of school. So it's that that's how I like to think of it when I'm looking at school avoidance. Is it pulled towards home because it's more fun, pulled towards home because of worry about the parent and family, or pushed away because of specific anxiety or non-specific anxiety? In mental health, as many of you know, we can often break things down into two broad categories, which are what are called internalizing behaviors and externalizing behaviors. So the internalizing behaviors are what you're feeling inside: depression, anxiety, worries, and sometimes parents, educators, others don't know that's happening for a child. Sometimes a younger child won't have the words to express it themselves, be in touch with their feelings, express their feelings. And then we have what are called externalizing behaviors. Kids who are not listening, kids who are being disruptive, kids who are running around, things like ADHD or oppositional defiant disorder. The two are often very closely linked. The most common diagnosis that goes with conduct disorder, which is a more severe form of behavior, is anxiety. So the two are not mutually exclusive, of course. And I think as one thing that we should all keep in mind is that a child with an externalizing behavior, quote, misbehavior, we really have to look at what's going on in their internal life and not view it as just bad behavior that needs to be corrected. So that's an important piece. The PPT, I think, and Mary can also comment on this, when should a PPT recommend a psychiatric assessment? That's a tough one. I think in terms of thinking this through, I'm just asking the question out loud. Oftentimes more information is good and helpful. When you suspect, I would say when you have a child who's had emergency room visits, has been to the hospitalization, those might be clues that a psychiatric assessment would be helpful. It's most helpful if the parents are having difficulty accessing outside providers or the school's having difficulty communicating with outside providers. Because then a psychiatric assessment that you have access to or the school district has referred to provides some insight and recommendations around what is going on for a child. But if that information can be obtained in other ways without requesting formally a psychiatric assessment, it would be better to proceed that way. So I think a psychiatric assessment is something to consider if the high intensity behaviors continue and are really hard to get out to address over the years. There are outpatient services in place and we're not moving forward, or there's a dearth of outpatient services in place and the parents have struggled to access care and therefore we don't really know what's going on with the child. So that might be one version. And a psychoeducational evaluation will do that in part. I'm feeling I should pass this on to Mary. There were some other points I wanted to make, but I think I will share that with you, pass it on to Mary, and I can come back to questions if needed.
Thank you, Dr. Poncin. Kathryn, and I want to thank you for inviting me. I'm really delighted to be a part of this with this wonderful group. Time check, it's 1:24. Would you like me to 1:30? And then we're moving on to another topic just for.
No, you're okay. Take your time. Yeah, take your time, and you can circle back to Dr. Poncin as well if you need to.
Okay, wonderful. So I first had wanted to start off with an explanation of where I work and my service and all of my interactions really with many stakeholders, including schools and Department of Special Education and State Department of Education and many, many community agencies and collaborators. So I work on the Children's Psychiatric Inpatient Service. For those of you who have not been here, we're part of Yale New Haven Children's Hospital. We're across the street, not in the main building. And my specific role is as a member of the Yale Child Study faculty. I run the educational program on the unit. And so we actually have approved by the State Department of Education. We actually have a school on the unit called the Yale Child Study Center School. And so Children's Psychiatric Inpatient Service, Yale Child Study Center is an integrated hospital child study university program. So what do we do here? We have 24/7, it's an inpatient psychiatric unit, up to 17 beds. And so we do multidisciplinary evaluations. Dr. Poncin had spoke to a question about when does a school do a psychiatric evaluation? Well, the children who come into the emergency room who are authorized to be on our unit have really exhausted so many resources that they now require 24/7 intervention to stabilize. So we do multidisciplinary team meetings, psychiatry, psychology, social work, family assessments, therapeutic rec assessments, many assessments. And part of the assessment is also an educational assessment and a consult. So in a given year, we will have 300 cases. Each one of those cases, a child attends our school. We're able to work with the schools, parental consent, we speak to the schools. Many of our children have had Section 504 plans, many have had PPTs, many have exhausted every outplacement. And so they've gone through all of those educational plans and have not done well. We have had children on the unit who have been on homebound, unfortunately, sometimes for months at a time. And so it's really our goal here to stabilize children and return them back to their less restrictive environments. So barriers to success. The children that we see are ages 4 to 13. The barriers to success are many. Many are living in less than optimal conditions. We see children in DCF custody who have layers and layers of trauma, children who have learning disabilities, children who have depression, anxiety, children who have obsessive compulsive disorder. And so all of these mental health diagnoses, learning disorders, they're all barriers to a child succeeding in school with the many requirements that a child has in school. So the children we see have these very complex psychiatric problems, very complex educational problems. What we begin to do is, as we stabilize the child, we really want to work with schools and really try to take the clinical information and integrate it into educational objectives and really try to start that plan of setting a child up for success. And so many of our children who are getting expelled, who are getting suspended, all of these things schools have to do for externalizing behaviors. Well, we may reframe that child as having depression. And so we really provide a lot of education to schools. Schools need a lot of education. This is where Dr. Poncin comes in, many of our child study faculty. Mental health diagnoses can really reframe a child. And we try to, again, stabilize the child, but then really match some strategies and interventions to help with a more successful school experience. And it varies depending upon how the child has been presenting in school and depending upon the stability here. We do get involved in making recommendations. We certainly want to see where the child is functioning in school. But prior to coming here, it's important for us to know, have they had a 504? Has the family had a PPT? We certainly can, as a clinical team, help with those recommendations. And so sharing a clinical diagnosis and then helping with starting to formalize those interventions for children so that they can start to have some form of supports. I will also say that we do get children in our unit who do quite well in school, and school has been a strength for them. But it does run the gamut in terms of, I will also say that the post-COVID world, in making recommendations and trying to implement strategies with all of our community schools, special ed schools, it is becoming more challenging, and I do worry about understaffing in schools. Our special education teachers, I was at a conference a few weeks ago. It really is a crisis in our state, and I believe nationally. We don't have enough special ed teachers to manage the needs of our children with really significant learning needs. So I think I always try to keep that in mind in terms of what resources are available. I feel that we're dealing with, Dr. Poncin had made a comment with regards to the needs of our children. We have more and more mental health needs in our school-age children, and the resources that we once had, we need more resources, and the resources appear to be lacking, and that really is something that we need to keep in mind. I think with that, I would just like to share that we are able to help with some positive transitions back to school. And one thing that I think is more helpful now in terms of providing services for children with mental health needs is that there's less stigma about children with mental health needs. So I do find that schools are certainly more receptive to understanding clinical diagnoses and how depression and anxiety, how they can manifest themselves in school. Also, I believe this is a post-COVID phenomena, but there is more of an emphasis in all schools on social emotional learning. And so I think that schools are really more receptive to modifying academics, spending a lot of money on trying to have social emotional learning programs that are evidence-based. And that is also, I do see that as a positive trend. I think with that, I will end, but it is a good resource here. We do see 300 children a year. We do 300 school transition plans per year. And we certainly are able to make a difference in a child's life. We can't fix these complex problems, but we certainly can begin to provide some education and support for children and for their families.
Thank you, Mary, and thank you for emphasizing some positive, which is always helpful. One thing I wanted to pull out that I think is really interesting is having that healthy sense of curiosity about what this child's experiencing and how it's manifesting and what can be helpful. That's something that I think as advocates and as attorneys, we're always trying to encourage school people who are, of course, incredibly understaffed and under-resourced, but trying to encourage that sense of curiosity as to, okay, how can we really get at the heart of what's going on here? What can we do that's creative? What can we do to work together to support this student and, not just feel hopeless from the start, which is a tough barrier sometimes in and of itself. I know Dr. Poncin was going to hop in for one more minute too.
Yeah, thank you, Kathryn. Actually, it dovetails with what I was thinking, which is that as what I found most successful, and I'm sure for many of you, is when there's trust between the school and the parent. And sometimes that's frayed trust, but it's trust between the school and parent, communication between school and parent, and communication with providers and the school. That is very important, and where you can encourage that, parents wanting the school to do something, but also allowing the school to have access to things that will be helpful. I think the other thing in terms of the lens, which is different than might be a lawyer lens, is what has the family done clinically? So my lens is, what has the family done clinically to help this child? Is it unreasonable almost to expect the school to do more for the child, even though they're obligated to? Has the family seen the doctor to clarify what insulin dose so that the nurse can administer the insulin? The nurse can't figure out the insulin dosing. So that would be the analogy that I would use. Has the family done what they can do? Because I think that will determine what specific needs. And in terms of advocating, what I've found most helpful, being kind of an observer of this, is just to know, and this is for non-lawyers, to know the rules, to be able to speak to the language of the schools, and to therefore not get into arguments, but just speak very firmly and assertively, but politely around least restrictive setting. Are we meeting their needs? And just knowing familiarity with the language so you can speak from that perspective.
Dr. Poncin, I also did want to dovetail on the importance of the work with families whose child is in the hospital, who's not doing well in school. The language of school is extraordinarily complicated. And so that is another very, very important piece of our work here, is to work with families and educate families and empower families. They are not helpless, and to provide resources to families, because they really, when they have a massive problem with their child in school and their child is on homebound and they don't know where to begin, it really is important to provide them with those, the process by which you start a formal educational intervention.
Thank you. Yeah, I mean, I think as a segue, that is so helpful, because when we're thinking about any of this collaboration or advocacy, or however we may think of this relationship, we're starting with trust at the foundation of it. And so if we're in a school setting, and there is some special lingo, or there is, something to navigate, the more trust in the relationship between the parents and the folks at the school, the more that they're going to be able to build upon that and really look at the common goals. And we know, unfortunately, that's not always the case. And so when that relationship is fractured, and, it doesn't have to be a contentious adversarial thing, but, parents need to really know about what their rights are in that situation, know how to assert themselves as experts in their own children and what they think their child might need to be successful, bringing some of those outside providers to the table and doing their part outside of the school building to make sure, like Dr. Poncin and Mary and Ms. Gonsalus were saying, making sure that they're handling the medical needs and handling the clinical needs at home or in the community, And so bringing all that to light and then kind of addressing it at the table with the school. So that is our segue on to Christina, who is going to, as we said before, she's going to lay out a whole seminar, really a whole law school class in about 25 minutes. But we'll make sure that we kind of pull out and highlight some of the main points and keep these connections going. And again, thank you for your questions in the chat, and keep those coming. Thanks so much.
All right. So good afternoon, everyone. Kathryn, CCA and the OCPD, thank you for having me. So as Kathryn said, I've been asked to kind of do a special education overview in a very short, it's a lot of information in a very short amount of time. So I will try to not talk too quickly and also try to talk quickly enough that we get through what we need to get through. And you're able to walk away with sort of a basis of knowledge if you haven't experienced special education process before. We'll talk about referrals, IEPs, and sort of the process for that. And then we have a couple of special topics that we want to talk about specific to children with behavioral health, mental health, and discipline kinds of needs, because I think those are important as well. So what you have in front of you is just kind of the framework for the special education process. It always starts with a referral. When there is a referral, the school holds a meeting. It's called a PPT, a planning and placement team meeting. That team would recommend about, and we're going to go through in more detail for each piece, but just to give you a framework, the team generally would recommend evaluations, and then they, after the evaluations are finished, would come back to a PPT, make a decision about eligibility, and if the child's eligible, then they would write an IEP, which includes the child's program and what kinds of services the child will have. And then, of course, as that is implemented, number one, districts have to implement what's in that IEP, individualized education plan. And it can always be revisited if circumstances change, if they realize that the IEP in place isn't working, if more services are needed, whatever it is, that's a sort of a constant evolving process. All right, so let's go to the next slide, and we'll talk about we'll talk about the referral and evaluation process. So the first thing is, in order to be eligible for special education, you have to sort of meet the criteria of one of the things on the screen that's identified. They do have to place you into one category based on your disability. And frequently children who have behavioral health needs, who are experiencing what Dr. Poncin referred to as school avoidant behaviors, it's not unusual for those kids to sort of fall within that category of emotional disability. But they can fall in other categories as well. Other health impairment can be fairly broad. Sometimes kids with school avoidance have underlying learning or language impairments that maybe we haven't figured out yet. Child's in 8th grade and they're starting to have behavioral problems, and when you do assessments, you might discover that there's a learning disability. So there are, these are the categories. I'm not going to go into detail on each category. And I think just in the interest of time, we will move to the next slide. So in order to be eligible to receive special education, it's not just based on diagnosis. If you have a diagnosis from your pediatrician or your child's psychologist or psychiatrist, and you bring that to the school, that is not going to automatically mean that the child is eligible. Right. So it's the criteria are, number one, the child has to have a disability. That disability has to adversely affect educational performance. And they require specialized instruction as a result of that, right? And so if children are eligible, that's what they, at the end of the day, that's what they're required to receive, is specialized instruction to address whatever their particular needs are. Okay, next slide. So I want to talk a bit about child find. So every district has an affirmative obligation to seek out and find and evaluate and identify all children with disabilities who need special education and related services. So if a child is failing, not attending, having behavioral issues in the classroom, the district is supposed to refer that child, and the parent should get a notice that says your child's been referred, and we're going to convene a PPT meeting to determine if the child needs to be evaluated. But I think it's also important for people to remember that in terms of referral, there is the child find obligation, and that's the obligation on the district. But there is also the ability for anybody to do a referral. And so parents can do referrals, pediatricians, clinicians, it can be anyone. And so if you're working with a child and there is a suspicion of disability that's adversely impacting education, you encourage the parent to make that referral in writing to a school administrator, right? So they send an email to the school principal, they write a letter, but they want to do that in writing, and say, I'm asking for a PPT, I'd like my child evaluated. And then the PPT would be scheduled. The district has an obligation to process any referrals. I just want to talk about, and we can move to the next slide, but I want to mention also, there are a lot of different reasons for referrals, right? So the law specifically does say it's all children who are suspected of having a disability, even if they are moving from grade to grade. So just because a child's passing, just because they're moving grade to grade, doesn't mean there's no adverse educational impact, right? So reasons for referral can include poor attendance, right? The child who is unable to get themselves up out of bed in the morning and get to school, and the parent just cannot get that child to go to school. Poor attendance, repeated suspensions, unsatisfactory behavior, unsatisfactory progress, and difficulties with and sort of withdrawal from social engagement. Those are all appropriate reasons to refer for an assessment to determine if the child has special education needs. Let's see what we have next. I think we're moving on. And I should say, once that process starts, from the time of the referral to the time of determining eligibility and developing an IEP, it's a 45 school day process, excluding the time for parental consent. So there's going to be some time where the PPT makes a recommendation for evaluations, and then the parents have to sign consent. The parents hold on to that form for 2 weeks. That's not going to count in the 45 school days, but overall it's a 45 school day process for the evaluation and determinations to be made. Let's go ahead to the next slide in terms of evaluations. So these are the kinds of evaluations that are typically recommended by the PPT, right? So they would typically do a cognitive assessment once the intellectual functioning of the child. They typically would look at social, emotional, and behavioral. They would do academic testing. Is the child on target for grade level, right? Reading, writing, math. And it's not unusual for speech and language if that's, potentially one of the issues. And then there's sort of a host of additional evaluations. I think what's important, a couple of things that are important to remember. Number one, the school is required to assess in all areas of suspected disability. And so if you're, an attorney for a family, or working with a family, you really do want to kind of look back at the child's educational history. As an attorney, I would always review the entire educational record. I would get that from the school. Parents are entitled to a free copy of their educational records, the entire educational record. You read that and look for those clues as to what could be the problem. And you want to make sure you're getting evaluations in all areas of suspected disability. The evaluations have to be multidisciplinary. They have to be decided by the team. They have to consider all of the existing information and data. They're required to be comprehensive. And of course, they're required to, parents have to consent before they can be conducted. And the other thing that I think is critically important is it's individualized. So it's really about who is this child? What do we need to know? Number one, we need to know, does the child have a disability, and does the disability adversely impact education? But we also need to know, does the child need specialized instruction? And if the child's determined eligible, these evaluations are also going to be used to decide what goes into the individualized education plan. So we want those evaluations to also include information about what kinds of supports, modifications, and specialized instruction does this particular child need in order to make progress. So you want to make sure that when a PPT makes recommendations for evaluations, that we ask the right questions, and that the evaluators, and typically the district's own people, do the first set of evaluations. You want to still say, can we share questions? Can we ask specific questions of the evaluation, so that you get as much information as possible. All right, so going on to the next slide. Once the evaluations are completed, there's going to be another PPT. And at that PPT, they're going to review the evaluations, and they're going to make a decision about eligibility. So again, like I said before, they've got to consider all of the information. And I think it's important to remember parents are part of the team. So parents' input is just as important as anyone else's input in terms of any decision that a PPT makes, okay? There are eligibility worksheets. Very often in a PPT meeting, the parent will not see that worksheet. I think it's important if you're there as a support for the parent, whether an attorney or in a different role, to ask, are you filling out an eligibility worksheet? Can the parent see a copy while we go through the questions? Because the parent is sitting there and the team's answering these questions, and they don't know if yes or no is the right answer, right? Because it's all based on the form. So I always encourage people, and when I used to attend a lot of PPT meetings, I would always say, can the parent have a copy of the form so that we can follow along with the questions that the team is trying to answer? And I should just note here, parents can invite whoever they want to any PPT meeting. So they can, bring a clinician, they can bring a friend if they have a friend who is, moral support or is just sort of more calm under pressure. They can bring whoever they want to the PPT and have them assist with advocating. And I just saw a message pop up. So I see a lot of them. So maybe we'll,
So Christina,
we can come back to questions, right?
Christina, if you want me to hop in to help you out. So somebody was mentioning in the chat that you can and should ask for evaluations 3 days before PPT.
Absolutely.
Yeah, so that's what they were mentioning.
Absolutely. And the district, for those initial evaluations, district is obligated to give them to you prior to the PPT so that you can review them. I will say, having practiced in this area, I have found it to not be unusual for the district to not provide evaluations before the PPT meeting. And I always encourage people, if that happens, when they hand you that evaluation, to say, I'm sorry, we're going to need to take a break. I need to read this evaluation before we can proceed. And they probably will give it to you next time. Because you cannot process the information in a 10 or 20 page report in the middle of the meeting. It's just very, very unfair. And so absolutely, you should be asking for a copy of the assessments in advance of the PPT. Okay, so I'm looking at a different piece of paper. I think we can move on to the next slide. All right, so before we go to that, let me just talk about the IEPs for a second. So when the student is identified as being eligible, the district is then obligated to create an individualized education plan. And the individualized education plan has to have a number of things, right? It has to identify what the child's strengths and weaknesses are, what the disability is or what the disabilities are. It has to have measurable goals and objectives built in. So if, for example, the child is coming to school 20% of the time, a measurable objective may be that the child is attending school 80% of the time. Or if the child is having behavioral issues, you might have a goal specifically to developing coping skills. And then it would be, you know, like in a one-to-one session, the child can identify, you know, 3 ways to cope with a particular problem. And then the next one might be, you know, that they can do that after an event happens, they can reflect on it and identify ways they could have be, you know, handled it differently. And then maybe the next one is in the moment, they can, you know, pick one of their coping skills and use it and sort of build on their skills. But it's supposed to have measurable goals and objectives. They're specific to the child. They're supposed to address all the needs of the child. So if the child is identified with an emotional disability, that does not mean that the district doesn't also have to address the learning disability that the child also has, because the eligibility is going to be based on the primary area of disability that adversely impacts education. But the IEP has to address all of the child's needs. It also has to include any accommodations and modifications the child might need. Anything from extra time on tests to a one-to-one paraprofessional that's with them all day long. That those are supposed to all be spelled out in the IEP, and how many hours of special education, how many hours of related services, where those are delivered, all of that goes into the IEP. For a child who has behavioral issues that impact their education, there also should be a behavior plan. And we often referred to as BIPs, Behavior Intervention Plan. And when those are created, they really should be based on a functional behavior assessment. So if you have a child who's been identified, they're eligible, now they're having behavioral health issues, that's a time to request a PPT, ask for a functional behavior assessment so someone can assess the sort of why the child's behaving in the way that they do and what are the appropriate interventions. And then you develop a behavior intervention plan to try to address those. And my personal view is the behavior plans really should look like, what do we do to prevent behaviors first and foremost? What do we do when we see behaviors begin to de-escalate? And then what do we do if there's a crisis? And that should not include calling the police. It should include meaningful intervention that's specific to that child. So one of the reasons, and this goes to this slide, one of the reasons that having an IEP is important is that when children have behavioral health disabilities and it impacts their behaviors in school, and they come to the attention to the school for things that they may be disciplined for, there are some protections that exist. And so if the child, so generally speaking, if the child engages in behavior that's, you know, a violation of the school policies, they can be excluded from school for a time, right? They can get suspended, they can get detention, etc. So what IDEA says is that if they have been excluded for more than 10 days. And that could be, we want to expel the student for 30 days, or it could be a pattern of exclusions. And I think we could probably go to the next slide. It could be a pattern of exclusions. So if the child is suspended 3 days in September, and then 3 more days in October, and then 5 days in November, and it adds up to 10 days, and it's a pattern of practice, which is a bit of a subjective test, but that's the test. Then the district essentially cannot exclude the child for an 11th day until they've conducted a manifestation determination review. And all that is a special meeting. Usually it's a PPT. They have a PPT meeting. And at that meeting, they have to ask 2 questions. Is the conduct caused by, or did it have a direct and substantial, did the behavior have a direct and substantial relationship to the child's disability? And then secondly, was the conduct a result of the school's failure to implement the IEP? Can you go to the next slide, please? And so essentially, and this is sort of the graphic, right? If the conduct was caused by or substantially related to the child's disability, then the district cannot then exclude that child. The concept being that would be disability discrimination. If you're excluding a child based on behavior that is substantially related to, caused by or substantially related to their disability, that would be discrimination, and we don't want that, right? So the child is allowed to stay in school, and there should be a plan for addressing those behaviors, right? It doesn't sort of say, okay, well, we throw our hands up, he comes back in, or she comes back in. They're allowed to come back in, and then we should also be saying, okay, well, now what do we do? How do we amend the behavior plan? What supports do we put in place? What else needs to be provided to this child to be able to be successful in school? If the behavior is not a manifestation of the child's disability, then the school can proceed with whether it's a suspension or expulsion, but they can proceed with that exclusion with whatever process applies, whatever due process applies. Expulsion, there are hearing rights that apply for expulsions. Second question, was the conduct a result of the school's failure to implement the IEP? Again, if it is, that child returns to school. And if it is not, then they may proceed with the normal disciplinary, exclusionary discipline that they're going to do. Okay, next slide. And so I just let me just back up. So practically speaking, what happens there, right? The child gets suspended, the parent gets a call, they say your child can't come back to school. Very often, if it's a situation where, well, let me back up. If it's a situation where they're doing an expulsion, typically the school will say, okay, we have to do a manifestation review and we're going to schedule a meeting. They should. If it's a pattern, the school doesn't necessarily always tell the parent that, okay, we have to do a manifestation review. So it's important for parents and people who work with parents to be aware of that pattern rule, that if there's a pattern of exclusion that adds up to more than 10 days over time, that the manifestation determination review is required. And so when the parent gets the call and it's a 5-day suspension, but now we're up to 15 or 20 days, that the parent is saying, okay, I want to ask for a manifestation determination review, and have that meeting. And the district can't move ahead until they do that meeting. So they're going to schedule the meeting quickly, but that meeting has to happen before they can then exclude that child. And the exceptions to that. So there are some exceptions with which we call IAES, interim alternative educational settings. So for certain students, if they've brought a weapon, illegal controlled drug at school, or serious bodily injury to another person in school, then they can be excluded even if it's a manifestation. But it would be to an alternative educational setting for 45 days. They still have to receive the services in their IEP. they're still entitled to education, but they can be removed from that setting for a period of time. Okay, I think I'm going to pause there, Kathryn.
Sure. Yeah, I have a few advocacy points to bring about. First, just to go back to manifestation determinations, wanted to highlight as a practical matter when you're at an MDR and representing a family or working with a family in any capacity, the determination is based upon the whole child, the constellation of the child and their issues and their needs. And so sometimes schools will say, okay, we're only looking at the child's primary eligibility category. So if this child has a learning disability, we're saying, well, the learning disability did not make him pull the fire alarm. That may be indeed true. However, their ADHD may have contributed to the pulling of the fire alarm, right? And so that is a complete misreading at best of the statute, and that we are not, just narrowing in on primary classification for that determination.
Kathryn, can I add one other thing to that? Because
Yeah.
I think that's very on point. The other piece is, if the school knew or should have known the child had a disability, you can still ask for a manifestation review if they should have evaluated, right? So if the school's been on notice and they have not met their child find obligation and evaluated, and you add, as an advocate, someone helping the parent, you look in and say, wow, why hasn't this child been evaluated for special education services? And I think this behavior is a result of this disability. You can, at that point, ask for the child to be evaluated, and they essentially can't proceed with the manifestation determination review until they get that evaluation completed and make a decision. And then they, assuming if it's not a manifestation, then they can proceed with discipline. But you can ask for evaluations if the school was in fact on notice that the child had a disability. Right. So I think that's important too. And sometimes they're identified, but there's another disability that they have not assessed for, and we need an assessment to determine whether or not the child has that issue and whether or not that impacted or whether that was substantially related to the behavior.
Yeah, and that's part of what I think makes, especially in Connecticut, our child find definition based on our special education regulations so powerful, is because it really outlines this is when you must be referred to PPT. These are the specific red flags. And so it really operationalizes what that should look like. And it's rare to have a kid that they're moving towards expulsion that hasn't demonstrated one of those red flags previous, right? A few other quick notes that came up as you were talking. Usually I'm the one doing that portion, so it's nice to hear somebody else do it, and then I actually have some thoughts. Meaningful participation for parents, that is totally of utmost importance as a principal in special education. What does that look like? What does that sound like? What does that feel like? That means that the parent is an integral part of the team. It is not the parent is showing up and the school is delivering their decision, right? It's far from that. And the parent is part of that decision-making team. To that end, there is a provision that has been kind of reinforced in legislation this year, which is the Multilingual Learners Bill of Rights. And so we've advocated for this for a long time, and there's been some great grassroots organizations that have been at the forefront of really saying for a parent that needs additional language access for a PPT meeting for the documents in question that are being reviewed. What does that meaningful participation look like? Well, it looks like at the least interpretation for the meeting, right? But also additionally translated documents. If you are reviewing documents at a meeting, whether they're evaluations or what Christina was saying, eligibility documents, in order to participate as fully as everybody else is participating, you have to have that same access to those documents to be fully part of that conversation. And so this provision, so it's Public Act 23-137, kind of, I think it really codifies what we would have practiced anyways. but even more clearly states what the rights are for parents in that situation. And I think the principle of meaningful participation goes really far in special education, and I think can't be overstated. Christina, I want to give you an opportunity to any final words of wisdom.
Yeah, I was just trying to get the chat up on my screen because I know there were some other questions, but no, I mean, I agree with that. And you know, it's tough because when parents go to PPT meetings, they are a full member of the team. They're not always treated as a full member of the team. And that's part of why, you know, I think it's important to encourage parents, if they're working with a professional who has feedback and insight and can provide education to the team about the needs of the child, to bring that person or get them on speakerphone, because they have the right to do that. And it's not unusual for districts to misunderstand or misperceive, for example, a child who is having difficulty with attendance. It's not unusual for them to say, well, he does fine when it comes to school and you just need to get him here. It's not that simple, right? If it was that simple, the parent would have done it already for most parents. And so sometimes it is really important to have a professional there to say, look, I'm a professional and I'm telling you that this is actually a disability. Here's how it affects this child. And this is why the child needs supports and services. So I'll stop there. I know we have limited time.
No, that's great. I think it's fleshing out the understanding. And again, kind of, if I go back to the theme of curiosity, right? Like we're trying to understand. We're not writing a kid off saying, this is willful, this is purposeful, this is, any kind of judgmental language that we want to use. This is even manipulative or whatever language that a teen might even use about a student, right? It's trying to understand the roots behind it, trying to work with the providers who have this kind of unique lens and expertise to really, get to what's going to be helpful in intervention, really. And I think when we have students who are school avoidant or students who are demonstrating behaviors that are challenging to deal with, it's very easy to make kind of snap judgments and try to, absolve people of responsibility when really they have to work with the child that walks in the door, and that's their legal responsibility. Okay, Mallory, we've hit many topics. And you're going to, no pressure, kind of bring it home a little bit, and then we will summarize everything. But transitioning over to Mallory James Sanchez, as I mentioned before, our newest team member at CCA. And Mallory has some incredible experience with the Yale gender program and is going to bring some perspective to us around the specific needs of youth who are being bullied or harassed under some different definitions and what their legal protections are. And this is another thing that is going to prevent a student from being successful in school, whether they're there or not, but is going to definitely inhibit their ability to be successful and is going to, would infringe upon their legal rights. So what are the tools we can use to support these students? Take it away, Mallory.
All right. Can everyone see my screen, but not see the bits I don't want to be seen?
Correct. Just the bits that you want to be seen.
Okay, great. So again, I'm Mallory James Sanchez. I use they and she pronouns. I am a Singer Fellow with the Center for Children's Advocacy, and my project is on LGBTQ youth advocacy. So today I'm going to do a very brief overview of Connecticut's current/upcoming bullying law, focusing on what schools are required to have in place to both prevent and address bullying, and what recourse exists for students who have experienced bullying, including federal civil rights laws. So first, as Kathryn noted earlier, I just want to sort of do this again though. The definitions of bullying have changed. So the current definition as of July 1st of this year is unwanted and aggressive behavior among children in grades kindergarten to 12 that involves a real or perceived power imbalance. And as Kathryn also mentioned, which something new to this legislation is the inclusion of challenging behavior, which I just wanted to flag, but isn't really going to be the focus of this because what I'm talking about here is more sort of like interpersonal conflict as opposed to challenging behavior, which might be someone having behavior on their own. So by early 2024, an advisory committee will develop Connecticut school climate standards based on nationally recognized school climate research and best practices. And then beginning in the 2025 to 2026 school year, each local and regional board of education will have adopted and implemented this sort of standardized policy. They can adopt it sooner if they wish to. So this was in the legislation that was passed or that went into effect this current year. But what that means is that the current requirements for schools to develop and implement safe climate plans are still in effect until this sort of like statewide standard is established. So what is currently required is that local and regional boards of education develop and implement a safe school climate plan that addresses bullying. And that also includes having someone in the school designated as a school climate specialist who's responsible for investigating reported acts of bullying. And each school must have a school climate committee who are responsible for sort of developing and then continuing to develop a safe school climate and addressing issues of bullying. So there are 18, I'm not going to read all this, don't worry. There are 18 different requirements in the current sort of scheme of things. And generally the climate plan has to include both prevention and intervention strategies. It has to include the language in the student code of conduct regarding bullying. And it has to prohibit bullying on school grounds, at school bus stops and school vehicles, but also outside of school if the bullying creates a hostile environment at school for the student against whom it was directed, or if it infringes on the rights of the student against whom it was directed at school, or if it substantially disrupts the education process or the operation of the school. And additionally, all school employees have to annually complete training, and they must be provided with a copy of the school climate plan. In terms of investigating and reporting bullying, schools are required to have some mechanism for students to anonymously report bullying, as well as a mechanism for parents and guardians to file written reports. School employees who witness an act of bullying have to orally notify the Safe Climate Specialist and then file a written report. The Safe Climate Specialist is required to investigate all reports of bullying and to ensure that that investigation happens promptly. And this includes anonymous reports with the caveat that if the only evidence the school has is an anonymous report, then they will not take disciplinary action. Once a school has investigated a report of bullying, if it's been substantiated, they must notify both the parents of the student who was affected and the parents of the student whose behavior was investigated. The school must also invite the parents or guardians of both students to separate meetings to communicate what steps the school has taken to ensure the safety of the student who was targeted and to prevent further incidents of bullying. Because of FERPA and HIPAA, the school is not allowed to give specific details of disciplinary actions or interventions such as counseling to the other students' parents, but they do need to explain generally what steps they've taken to ensure student safety. So they should explain that they've conducted an investigation and maybe have some details about what that included, and what their interventions were and what the safety plan is. Additionally, schools have to have a procedure for documenting and maintaining records of bullying incidents and have to develop specific interventions for cases of repeated bullying, including safety plans. They are also not allowed to retaliate against either students or employees who report bullying or who assist in a bullying investigation. And I'm just going to check the chat briefly. Yes, I will make sure this PowerPoint gets shared. So those are the sort of main requirements of the current bullying law. And as I mentioned, once state standards are established, local and regional boards of education will be required to adopt those standards. So currently model language exists, and many schools follow that model language, but regardless of whether they do or they don't, their school safe climate plans have to include all 18 of these things. So that's kind of the overview of what Connecticut requires, but there are also federal laws that might be implicated depending on the situation. There's not currently any federal laws that prohibit bullying, but bullying may constitute a civil rights violation if it's unwelcome and objectively offensive, such as derogatory language, intimidation, threats, physical contact, or physical violence, and it creates a hostile environment at school, meaning it's sufficiently serious that it interferes with or limits a student's ability to participate in or benefit services, activities, or opportunities offered by a school, and it's based on a student's race, color, national origin, sex, disability, or religion, which are protected categories. So if you're working with a family and the student has experienced bullying, I think it's always worth trying to investigate and see if the bullying is on the basis of a protected class, because if it is, then you have a second sort of way to address this with the school. If it's not, you still have the bullying report and investigation and school intervention process. But if it is, you have this other process that you can use to kind of leverage and make sure that the school is following their obligations for student safety. So a school that fails to adequately or appropriately respond to harassment of students based on one of those protected classes may be violating one or more civil rights laws that are enforced by the Department of Education and the Department of Justice. And so this is just kind of an overview of some of the laws that could be implicated, but I'm going to talk specifically about Title IX, which covers sex, gender, and also protects students against sexual harassment and violence. So in terms of the sort of like general process for reporting civil rights violations, students have several options, and they can also report these are, civil rights violations because the school has not adequately responded to incidents of bullying on the basis of a protected class. At the state level, there is the Commission on Human Rights and Opportunities, CHRO. CHRO complaint process includes an interview by an intake officer, a response by the other party, an initial CHRO review, then either mediation and an agreement or a full CHR investigation and decision. There's also a state Title IX coordinator and the State Department of Education Office of Student Support. So every district has a Title IX coordinator. It's not always feasible for that person to sort of be the point person for a family, depending on the relationship with the school. It could be someone within the school, in which case the state Title IX coordinator might be a better resource. There's also you can file complaints with the Department of Education, Office for Civil Rights, OCR, and the Civil Rights Division of the Department of Justice. Something I want to focus on is the topic of LGBTQ youth. So LGBTQ youth are protected against bullying and harassment in Connecticut on the basis of state anti-discrimination law. So there was a comprehensive law in 2011 that expanded the protected groups in Connecticut to include sexual identity, or gender identity and sexual orientation. As I mentioned, there's the Connecticut bullying statutes. There's also Connecticut State Department of Education guidance. So this was released in 2017. So it states that schools must create a safe school environment and treat students consistent with their gender identity or expression. Failure to treat students consistent with their gender identity or expression creates a discriminatory environment in violation of state and federal laws. So that the guidance includes a lot of details on how transgender and gender nonconforming students should be treated in schools. It is from 2017, so it is kind of outdated. There is an updated version that's supposed to be released soon, and we're hopeful that it will include, it will reflect input from various stakeholders and advocacy groups and help address some gaps in the current guidance around student rights. And so LGBTQ students are also protected by federal civil rights laws, including Title IX. So Title IX states that no person in the United States shall, on the basis of sex, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any education program or activity receiving federal financial assistance. So all schools that receive federal funding, which is every public school and most private post-secondary schools, must enforce Title IX. Title IX's mandate does protect LGBTQ students in Connecticut. In addition to case law and federal guidance documents that make clear that gender identity and sexual orientation are included in the definition of discrimination on the basis of sex, the 2022 proposed amendments ban all forms of sex discrimination, including discrimination based on sex stereotypes, sex characteristics, pregnancy or related conditions, sexual orientation, and gender identity. The proposed regulations also state that preventing any person from participating in an education program or activity consistent with their gender identity would subject them to more than de minimis harm on the basis of sex and would be therefore prohibited unless otherwise permitted, which gets into some athletic stuff that's not at issue here. The final Title IX rule, we're anticipating to be released next month in October. It was delayed a little bit, so the comment period has ended, and hopefully this added protection for LGBTQ youth will be reflected in the final Title IX rule. And so my final slide is just some additional resources. So in addition to the designated safe school climate specialist, as I mentioned, each school district has a Title IX coordinator, which the current ones, although if you check the PDF, it says last verified 2019, so it might not be that current, are available on the State Department of Education website. And so parents and students can contact the Title IX coordinator for the district or the state Title IX coordinator for assistance in navigating the complaint process and resolving different incidents. You can also find, I won't say current because it's not reflective of the most recent legislation, but you can find Connecticut bullying and harassment statutes on the state website. There's also the Connecticut Association of Schools Safe Climate Resources. And then the Commission on Human Rights and Opportunities has, it's difficult to link to, but they have a way to file complaints online and an explanation of that process. And then finally, the Department of Education Office for Civil Rights has a resource page for LGBTQI students. And that's kind of my whirlwind presentation.
Mallory.
So, yes.
Question for you.
Yes.
The guidance that is, under review by the State Department of Education, what are some things that we're looking for further clarification on, or what are we looking at to speak to?
So right now it's unclear what rights students have in school when there's a dispute between students and parents over gender expression. So it's unclear whether and to what extent schools are allowed to support students when parents have affirmatively said that they don't want their student to use or their child to use a different name or pronoun at school. Regardless, so we're hopeful that the guidance will reflect schools' responsibility to affirm all students' gender identities and to make schools safe for every student. It would just be nice to kind of see that laid out more clearly. There was also, I know we're really low on time, there was a comment in the chat much earlier about the distinction between bullying and harassment, and there isn't. So the current law doesn't actually give a definition for harassment. It uses the phrase bullying and harassment many times, so that's what I did with the title of my presentation. But the statute defines bullying and it defines challenging behavior as a new category, but it doesn't actually define harassment. So sexual harassment under Title IX is a separate issue. But when we're talking about bullying and harassment, we're talking about behavior that falls under the state bullying law.
And we might also think of harassment in the criminal context, which is obviously outside of our purview, but that's probably similar.
Yes, schools in their safe climate plan also have to, so they're also required if bullying and harassment rises to the level of criminal conduct to sort of facilitate notification and investigation by the police.
Thank you. Okay, I think we got a lot of the questions as we went, feverishly typing and reading and multitasking. Thank you for those very good questions. I mean, a lot of the questions are practical, right? Like, we know this in principle. What happens when I'm at the meeting trying to say this? How do I make someone listen to me when I say the same thing? And so I think, some of the tools that we've talked about today is, bringing in your provider, working with your provider, getting a letter as specific as possible from a provider and someone that you collaborate with outside of school, with specific recommendations that ideally they perhaps could even come in and defend those recommendations and talk about the implementation of the school setting. Great way to go. Great starting off point. Talking about how to kind of set the stage at the PPT meeting, how to prepare for it, how to have the documents prepared, how to have the evaluations, insight to the evaluations, understanding what eligibility is at play, understanding what types of services, again, going back to a provider, what kind of services might be beneficial in the situation. That's how we're going to, get to that point of advocacy and looking at particularly IEP services and other services. And then, working with Mallory and figuring out how do we make sure that schools are safe at the very least, and a place where students can be free to access their education and flourish and learn in a safe and supportive environment. I mean, these laws are kind of exciting because they're very powerful tools, but they're also in flux. And so you really working together to make sure that we stay on top of those protections and those rights, and ensuring that we can assert those rights, if need be, so that our students can be in an environment that is supportive. Any parting words from our presenters? We still have a few faces and windows. I like that. Very good. Very good. Thank you all so much for being here and for being part of this. I mean, it's clear with the number of folks we had registered that there is there's a need for this, and there's people are really hungry for this kind of knowledge. Please reach out should you need anything or, need further direction. We will be providing slides and a recording. I tried to put as many resources as I could think of to answer these questions in the chat. But happy to continue to connect people to the right people who might be supportive. Thank you all so much. Thank you to our presenters. Take care.
Thank you.
Thank you. Bye now.